Hello, Joey RN is here. So as you can see, my board is under construction and I'm trying to see which one is better. So I hope next time I can give you a better or clearer visual aid. Today we will discuss about the types of questions that you may encounter in the NCLEX-RN exam. There are 9 types plus the NGN questions. NGN stands for the next generation NCLEX. Number 1 is multiple choice questions. When I took the exam 15 years ago, I was given 5 options to choose my answer from. And now the book says that you have 4 options. So you may be given a client situation and you'll have to choose among those 4 options which one is the correct answer. Second is fill in the blank. You may be asked to perform a medication calculation, determine an intravenous flow rate, or calculate an intake or output record in a client. You will need to type only a number or your answer in the answer box. If the question requires rounding the answer, this needs to be performed at the end of the calculation. The rules for rounding an answer are described in the tutorial or also provided in the specific question on the computer screen. In addition, you must type in a decimal point if necessary. Number 3, multiple response questions. You will be asked to select or check all of the options such as nursing interventions that relate to the information in the question. In these question types, there may be one correct answer, there may be more than one correct answer, or all answers could be correct. No partial credit is given for correct selections. You need to do exactly as the question asks, which will be to select all of the options that apply. Number 4, ordered response questions. You will be asked to use the computer mouse to drag and drop your nursing actions in order of priority. Information will be presented in a question, and based on the data, you need to determine what you will do first, second, third, and so forth. The unordered options will be located in boxes on the left side of the screen. And you need to move all options in order of priority to ordered response boxes to the right side of the screen. Specific directions for moving the options are provided with the question. Number 5, figure or hotspot questions. A question with a picture or graphic will ask you to answer the question based on the picture or graphic. The question could contain a chart, a table, or a figure or illustration. You also may be asked to use the computer mouse to point and click on a specific area in the visual. A chart, table, figure, or illustration may appear in any type of question, including a multiple choice question. Number 6, chart or exhibit questions. In this type of question, you will be presented with a problem in a chart or exhibit. You will be provided with tabs or buttons that you need to click to obtain the information needed to answer the question. A prompt or message will appear that will indicate the need to click on a tab or button. Number 7, graphic item option questions. The option selections will be pictures rather than text. You will need to use the computer mouse to click on the option that represents your answer choice. Number 8, audio questions. It will require listening to a sound to answer the question. These questions will prompt you to use the headset provided and to click on the sound icon. You will be able to click on the volume button to adjust the volume to your comfort level, and you will be able to listen to the sound as many times as necessary. Examples of this type of questions can be various lung sounds, heart sounds, or bowel sounds. Number 9, video questions will require viewing of an animation or video clip to answer the question. These questions will prompt you to click on the video icon. There may be sound associated with the animation and video, in which case you will be prompted to use the headset. Examples can be assessment techniques, nursing procedures, or communication skills. And the last type of questions are NGN questions. This is still under research, and the candidate will be informed if the questions are research items and will be given the option to answer them or to decline. This is still a pilot study by the National Council of State Boards of Nursing, and it will test the ability of a candidate for a safe and competent clinical judgment and given at the last or the end of the exam. And it is expected to be launched between 2022 to 2023. So here are the types of questions that you may encounter in this section. Closed item is similar to a short answer question. In this type of question, you will need to select a response from a drop-down menu. Next is dynamic exhibit and constructed response. It is a type of open-ended question that requires a short answer response. The answer is constructed using information that can be found in a dynamic exhibit, such as a case study. Next is enhanced hotspots. It may be presented in various ways. This question type could include an exhibit, a case study, assessment data or other information, or a figure in which you may need to use the mouse and cursor and point and click to locations as asked in the question. An enhanced hotspot may also ask you to highlight specific information. Next is extended drag and drop. It will provide you with several pieces of specific information and will ask you to order that information into the correct order of action or placement. Highlighting items. These items present data pertinent to a client case and ask the student to highlight the information that requires follow-up. Matrix items. These items present data regarding a client and may ask the student to select actions that are essential, non-essential, and contraindicated. And the last one is case studies and NGN items. These are specially designed to simulate the NCLEX experience of testing for this next generation NCLEX item types. So next time as we go along, I will give you specific examples on each type of question so you'll be able to practice and familiarize how to answer them correctly. And that's it for now. See you in my next video. Bye-bye.